Whenever you see anything, read anything about type 2 diabetes, metabolic syndrome and syndrome X are often in there. Are those all the same thing?
They're not all the same, but we do see a lot of interrelatedness between the two. So the metabolic syndrome is a syndrome, when we think about syndromes, we think about usually it's a constellation of risk factors, sometimes laboratory risk factors, sometimes physical findings. And so we define metabolic syndrome as meeting 3 of the following criteria, and those 3 can be in any combination. But when we look at metabolic syndrome, we're looking at the combination of the beginnings of metabolic disease, so prediabetes, increasing fasting blood sugar, leading progressively to type 2 diabetes, but then also we include risk factors for cardiovascular disease. And so these would include things like hypertension, high blood lipids, specifically high blood triglycerides, and lower HDL or healthier lipoproteins in the bloodstream. And when we combine those risk factors for cardiovascular disease plus the beginnings of metabolic disease, and we get that constellation of risk called the metabolic syndrome. Now, if the metabolic syndrome progresses and the fasting blood sugar crosses a particular diagnostic threshold for type 2 diabetes, then we just assign the diagnosis of type 2 diabetes. Usually that diagnosis of metabolic syndrome doesn't carry forward. Doesn't mean that the risk factors aren't there, and we know that people with type 2 diabetes have about 2 to 3-fold risk of developing cardiovascular disease and ultimately dying from cardiovascular disease as people without diabetes. So we see this clustering, and unfortunately we see those risk factors continue to get worse and worse, even beyond the thresholds that we diagnose the metabolic syndrome.